Hi everyone, my name is Hannah Himes and I'm going to be presenting on assessing the cranial nerves. So, why should we even care about assessing the cranial nerves? Well, this is one small part of the larger, more comprehensive neurological exam. So, it's important because it can point to specific and time sensitive diagnoses. So, it's important to be able to pick up on these issues as they arise so that we can get the patient help. Maybe there's something neurologically that's declining. There are 12 cranial nerves. 2 of them stem off of the cerebrum, as you can see here in the diagram. 10 of them stem off of the brainstem itself. Each of them has unique functions, malfunctions, and assessments as we're going to go through. Of course, we don't have time to go into all the malfunctions, so we're going to focus on the functions so that they can help you understand the assessments for each one of them today. Here are the 12 cranial nerves. We'll go through them as we go through the presentation, but at the bottom of the screen, you'll see a mnemonic that's going to help you remember the order of the 12 cranial nerves. So feel free to use that for memory purposes. First is the olfactory nerve. This is a sensory nerve for smelling. We assess this by having the patient cover one nostril at a time and presenting specific smells, vanilla, cinnamon, things like this that can be easily recognizable. A malfunction is anosmia. This means the inability to smell. Second, optic nerve. This is also a sensory nerve, and it's simply for vision. Assessments can include visual acuity, visual field tests, like presenting a moving finger while one eye is closed for the patient at any time, things like this. Ask them to tell you when they see the moving finger. There's a lot of different ones. I can't go over them in the time allotted. In addition, for visual acuity, things like you do at the optometrist each year, I hope, by seeing the distance at which you can see different letters they present, things like this. Malfunction is simply visual field cuts or lack of visual acuity. I grouped 3, 4, and 6 together because they're all about eye movements mostly, and the upper eyelid muscle as well. So you can see exactly what all of them do here on this slide. But to assess them all together, we will simply do what's called cat whiskers or drawing an H for the patient. So we can do this with both eyes and then with each eye individually, which I encourage, so you can assess it all. So you'll do cat whiskers like this motion, which is easily explainable. Or you can ask the patient to follow your finger whenever you draw an H in the air. That covers all these directions, right? Malfunctions include dysconjugate gaze, double vision, dilated pupils, ptosis, and ophthalmoplegia. I forgot to mention that this also covers pupillary restriction in response to light and things. I put a star by dysconjugate gaze because, fun fact, I was actually born with Duane syndrome, which is a disturbance in the development of 6 abducens. And so if you see, look closely, this is me trying to look to my right. My right eye does not go that way. So that's a fun fact. Next, trigeminal nerve, number 5. This is a mixed nerve, sensory and motor. So sensation of your face, mouth, and cornea, and also gives motor function to mastication muscles, so chewing. So of course, we can ask you to clench your jaw. We can ask you to chew, watch you chew, especially important for speech language pathologists, especially following a stroke. We can also test the sensation of these different areas. This is where you're going to see your corneal reflex come in, for example, us putting a little bit of cotton to your eye to see if you blink. We test this a lot, especially if we think somebody might be progressing to brain death, to test their brainstem functions. All just examples. Facial nerve, number 7. So this is a mixed nerve as well, sensory and motor. This controls our facial expression muscles, anterior tongue, taste, and our lacrimal and salivary glands. So the assessment can include these different facial movements: raising eyebrows, closing eyes tight, smiling, blowing cheeks out, and taste testing. Of course, malfunctions could include that unilateral facial drooping. Again, we see this a lot in stroke patients, or the inability to taste. Number 8, vestibulocochlear nerve. This is a sensory nerve for hearing and balance and equilibrium. We can do different hearing assessments, which we don't have time to go into the details of today, but you have heard of these two tests presented on the slide. And we can also test your balance in some different ways. Number 9 and 10, glossopharyngeal and vagus nerves. These are both mixed. Together, their assessments are similar. That's why they're grouped. Sensation of the tongue, larynx, pharynx, carotid baroreceptors and chemoreceptors, salivary glands, our vocal cords controlling how those are moving and functioning, and muscles for swallowing, not just chewing like the last one we saw. We can test your ability to swallow, speech language pathologists, and phonation, voice quality, things like this. A wet or hoarse voice quality, gurgling or choking while swallowing, or the symmetry of your palatal arch, uvula, or tongue can be indications of malfunction. Number 11, spinal accessory nerve. This is a motor nerve for shoulder and neck musculature. We can assess this by asking the patient to turn their head side to side and giving a little bit of resistance to them while they try to do that, like this. Okay, testing that strength. Also asking the patient to shrug their shoulders, okay? Weakness in either of these motions is a malfunction. Could be a malfunction. There's many reasons people could present with these problems, okay? Number 12, hypoglossal nerve. This is all about tongue movements. So assessing this can look at the patient's tongue while it's at rest. We are looking for corrugations or fasciculations in the appearance that could be a malfunction. We can also ask them to stick their tongue out. If it deviates one side or another, could be a malfunction of this nerve. Here are 2 questions I have. In someone with Duane syndrome, which of the 12 cranial nerves has a defect? And when testing the corneal reflex, which cranial nerve is being tested? Thank you so much for your time today.